On today's World Insight, momentum for international vaccine cooperation with China's aid pledge of a couple of billion vaccine doses this year, besides funding for COVAX. Can it start the ball rolling on world solidarity against the pandemic? And national security in the shadow of a variant-fueled pandemic and threats to digital security. How can China steer through choppy waters? Advice from an international relations expert.
The challenges of which are unprecedented.
Here is our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei from Beijing on CGTN. China has pledged to hand out 2 billion doses of COVID-19 vaccines for the world and help the vaccine alliance COVAX with $100 million, all delivered throughout this year. Chinese President Xi Jinping made that aid public in a written message at the first meeting of the International Forum for COVID-19 Vaccine Cooperation. Xi said that he looked forward to seeing the forum take new steps for equitable global access to vaccines, strengthening solidarity and cooperation among developing countries, and working together against the pandemic. Taking part in the forum are ministers from other countries, representatives of some international organizations and businesses. So how can the international community better cooperate on vaccines to curb the pandemic? Let's loop in our panelists. For more, I'm joined by two panelists in Seattle, Dr. Alice Kim-Kyung-Tan, internist at Ms. Medi Women's Hospital from South Korea. Good to see you, ma'am. And in Beijing via Skype, Ding Sheng Din from the School of Pharmaceutical Sciences with Tsinghua University. Good to see you, Professor. Let me start by asking both of you about the latest forum. 2 billion doses contributed by China for the rest of the year, and also about $100 million to COVAX. How much a deal is it in terms of its support to the global fight against the pandemic? Mr. Ding.
Yeah, I think the announcement made by President Xi today about these 2 billion doses of vaccine and also 100 million donations actually are very significant. Certainly, this is just for this year. I certainly think in the future, China will continue to make such contribution to the global anti-COVID-19 fight.
Dr. Tan, we know that COVAX is behind its schedule due to many reasons. There were countries that are putting preconditions to their previously earlier agreed pledges, for example. There's also issues of not enough manufacturing due to outbreaks in different countries, including in India. Dr. Tan, how much do you see those pledges could at least of some support to the global fight?
Of course, every drop counts. Right now, the WHO has a goal of vaccinating 40% of the world's population by the end of 2021, 60 to 70% of the world's population by mid-2022. But this goal right now seems almost unattainable given the deficit in funds and also in doses. So this huge donation proposed by China will really help in terms of garnering support and also the practical matters of funds and doses.
As you said, that there were earlier plans. If those plans are not being met, I mean the plans made by WHO as a pledge for everyone in the world, what would that mean in terms of the global capability of fighting against COVID-19? As we know, the longer we drag on, more variants will come out, more outbreaks of different waves will come out. Dr. Tan.
Absolutely. So unfortunately, what we're seeing right now in terms of the epidemiology, the forecast in the near future does not look bright. Right now, for the last month, there has been an increase in daily new cases. And also, there are many regions of the world that are seeing increase in deaths as well. And of course, this is fueled by the Delta variant. So as you very rightly pointed out, every day that this is dragged on because of inequitable vaccine distribution, there's just going to be more and more spread of the Delta variant. And also, we should not forget that the environment is ripe in some countries for the emergence of an even more virulent or perhaps even more vaccine-resistant virus. And of course, that would be a huge setback to the world. And so any investment that we make, right now I think the IMF is asking for $50 billion US, that will offset the trillions of dollars that could potentially be lost if the pandemic is allowed to drag on.
Dr. Ding, your take.
Yeah, I think certainly having this forum and also open channels actually for the global community is very important. So far, in a very practical manner, actually, manufacturing, contribution to the COVAX as well as distributions, really delivering all the vaccines to the needed country actually has been certainly delayed. But actually having such high-level discussion forum, and also actually international different body of organizations actually really talking and focusing on actually deliverable execution would really help for the next stage of this pandemic.
As both of you know very well, what we're facing right now is the new variant, the Delta variant, that is influencing China right now, beginning from May, some could argue, from Guangdong, for example. And that's also having a huge impact in South Korea, where you, Dr. Tan, are originally coming from, even though now you are living in Seattle. So how should we understand, the latest numbers in the United States it's also, once again, skyrocketing in other parts of the world, not to mention. So how should we understand the paramount crisis that is coming, and probably even more to come in the near future, Dr. Tan?
Well, Dr. Rochelle Walensky of the CDC has said that we are dealing with a pandemic of the unvaccinated right now, and that's what we're seeing in the United States. And also, unfortunately, in Korea, because Korea has a relatively low vaccination rate of 15% of the total population has been fully vaccinated. And with the Delta variant, this is really a game changer. The basic reproductive number of this variant is between 5 and 8. That means one person can potentially infect 5 to 8 other people. And that's more than double the reproductive number of what we had in the very beginning of the pandemic. And so it really doesn't make sense for countries to even think about easing measures when the Delta variant is circulating. But of course, that's what many countries are doing, unfortunately. And I think the UK is a good example. They were seeing a rise in cases. They decided to ease all of their measures. And unfortunately, they are seeing an uptick in deaths due to COVID again. And the biggest threat, I think, right now is to all of the children of the world. Fortunately, the first wave, the first round of COVID-19 pandemic did not take as big a toll on children, but we are hearing anecdotal stories from pediatric hospitals, children's hospitals in the United States, where pediatricians are seeing that they are seeing ICUs now fill up with children on ventilators due to COVID-19 because of the Delta variant. And almost all of the children of the world are vulnerable to this variant. And so it is of paramount importance that everyone either continue all of the non-pharmaceutical interventions that we've been doing up until now, or get vaccinated, and I would suggest both.
And also we are joined now by Dr. Kate Tulenko, who is the CEO of Corvus Health. Dr. Tulenko, good to see you again. It's wonderful to see you several times during the same months, but it also means that we are gathering to discuss very urgent matters. We are talking about the Delta variant and its tremendous impact on the situation right now to the world. You are based in the U.S. Tell me more about the latest.
So unfortunately in the U.S. we are seeing rising cases, and 80% or more of most new cases are the Delta variant. And as your previous guest said, we're seeing more children getting sicker. The saying now is younger, sicker, quicker. That in the past, with the past waves, it's mainly been older people, more vulnerable people, but now we're seeing people in their 20s, 30s be very ill. So that's why it's important that everyone who can get vaccinated, everyone 12 and older in the U.S. should be vaccinated.
And also, on the other hand, there is still reluctance to be vaccinated. Meanwhile, there's also lack of equitable distribution of the vaccines, and at the same time, not sufficient manufacturing of vaccine. We are seeing really different layers of questions all piled up right now. The earlier ones not solved, and the newer ones are not having solutions. Dr. Tulenko.
Yes, I mean, there are a number of different things to unpack there. Regarding, cooperation, I think we need to move beyond cooperation being defined as wealthy countries giving vaccines to low-income countries, and look at cooperation as increasing the capacity of low and middle-income countries to actually design and manufacture their own vaccines. And we know today that the Chinese government is holding a forum for cooperation on vaccines, and we won't be able to judge the success of that meeting today, because at all these types of meetings people pledge billions of dollars and they don't necessarily come through. I think in 6 months or a year from now we can see what resulted from this meeting and know whether or not it was successful. Another area I would like to see more money put into is the creation of new antivirals, because the anti-vaxxers, part of the reason they don't want to get vaccines is they say, I'm not sick, why should I put something in my body? But once they're sick, they usually will accept medicines. And we really still don't have very good medicines that target the virus directly.
Those points, I think Dr. Ding is very much in a good position to respond. First of all, the impact of the meeting today. We've seen many meetings over the past year or so, international ones. We see also countries pledging, but also countries putting preconditions on their pledge later. And we also see lack of manufacturing, as we said earlier, because of the latest situation of pandemic in India, that would not be able to contribute as much as possible, which is understandable. But Dr. Ding, how do you see the several different layers of issues that I mentioned earlier? Dr. Ding.
Yeah, certainly it is very complex, but I would say certainly having actually such forum dialogue actually among international bodies, especially at the highest level, actually would be useful. And then it's really about actually how all of us can work together on the execution side. In terms of manufacturing, I would say actually in China, as well as in other developed countries like U.S. Or other major developed countries, the manufacturing capacity actually are there. Certainly ramping up the manufacturing would not be a significant issue, given all the expertise, all the people actually trained on such manufacturing. I think it's just a matter of having the fund and also actually really deliver on those different promises.
We have been talking a lot about lack of international leadership, global leadership at this most critical time when it's urgently needed. But before we go to that area, Dr. Ding, I also want you to talk about the antiviral, because you've been together with your colleagues at Tsinghua University and working with your colleagues around the world, trying to come up with the right types of antiviral for the COVID-19, and also contributing to the research of the latest vaccines. Tell me more about the latest development from an expert's perspective.
Yeah, certainly the antiviral approach, actually therapeutics, would very much be useful. Um, Again, the existing actually antiviral, for example, the remdesivir, it's actually an IV drug. It's not very convenient for early access for patients. So that's why actually it's currently in urgent needs, especially in the context of Delta variant, which is spreads very fast. Early access to antiviral, even prophylactic use of antiviral therapeutics actually is so important. So that's why we and others, many other actually international biopharma companies actually have been really working hard on oral antiviral drugs. Several of those actually are being developed. We expect to have one actually nominated for early trials towards end of this year or early next year. Certainly, we already know Pfizer has one in phase 1 oral antiviral drug, and also very recently, Regeneron have actually one of their antibodies as subcutaneous actually injection approved for prophylactic use in individual exposed to virus. Certainly, antibody is still very expensive to manufacturing,
Right.
but having this subcutaneous version actually in the prophylactic setting actually is also an example of such utility.
I understand the Sinopharm has also recently announced that they have discovered some kinds of antiviral that might be helpful in terms of dealing with the Delta variant, but of course it is still an ongoing process, Dr. Ding.
Absolutely. For actually those variants, I wouldn't be very concerned, especially for small molecule antiviral drugs, because actually those small molecule antiviral drugs against actually different targets actually of viral replication, those have not been reported with actually mutations.
Now we know, Dr. Tan, that from now until the possible vaccine targeting or be able to better target Delta variant would only come into the market, hopefully, by the end of this year, early next year, for the earliest, which means from now until then, all we can do is better prevention and control. That's the only way we have. Otherwise, we go to herd immunity, which is, of course, the worst scenario if it's not by vaccines. So, Dr. Tan, we've been talking about this for more than a year, but ultimately, fundamentally, there are ways that we can do to prevent and control among the bigger population. I want you to repeat those important messages, first of all, and then help us to understand why don't just countries, localities, cities, people do it. This is beyond my explanation. Please help us to understand.
Right, so as you correctly pointed out, COVID-19, even with the Delta variant, is still largely a preventable disease. There are proven ways that we can keep COVID-19 in check. And we've been trying to get our public educated and on board with following these measures from the beginning: universal masking, hand hygiene, ventilation of indoor spaces, keeping your distance, avoiding crowds, testing early if you have any suspicion, the implementation of routine surveillance testing in high-risk venues. These are all measures that have been used successfully by many communities and countries around the world. The problem is some people, they don't recognize the need for them. Other countries, everyone is tired, and I think prematurely they're wanting to avoid using these measures, or prematurely they think that the coast is clear and their vaccination rates are high enough. But recently the CDC here in the United States, they reported a huge outbreak that occurred in Massachusetts, in Barnstable County, where there is a cluster of close to 1,000 cases, proven cases now, that happened in early July. And they were mostly of the Delta variant, and 3/4 of these cases had been vaccinated. And really the telltale lesson here is that even though the state of Massachusetts had a full vaccination rate of 69% of adults, that wasn't enough. With what's going on, we need to continue with all of the social measures and the public health measures on top of trying to vaccinate as many people as quickly as possible.
I understand, Dr. Tulenko, that in the U.S., there are still more than 40% of those staff working in senior care house, for example, that have not been vaccinated or do not want to be vaccinated. And now I know there are some enforcement by some of those centers. Do you see these kinds of executive, or shall I say, administrative measures would eventually work?
I think they will, and I think we'll see more of them. Probably by September, Pfizer will receive the full authorization for their vaccine, so it will no longer be an emergency authorization. And I think when that is the case, many nursing homes or continuing care homes will require their staff to be vaccinated, because by then it won't be an unproven thing. It'll be something that has full authorization. We know that the U.S. federal government is going to give all of its employees to be either the option of either being tested weekly or getting the vaccine. I think we will see many other employers do similar things.
China, Dr. Ding, has been able to have 1.7 billion doses being inoculated over the past 1 year. So what would that mean to the possible herd immunity in the population, if you could help us to understand better?
Yeah, I think we're just about over 50% being vaccinated. I think to reach the herd immunity actually will require much higher percentage of population being vaccinated. I think actually vaccine is still the most effective measurements to this virus. As others have already said, actually other measurements, wearing masks, social distancing, surveillance, contact tracing, those would also help. But on the other hand, I have to say, given over sort of 16 months, 18 months actually in this pandemic, I think at the global level, especially in many countries, vaccine, actually pushing a vaccine actually is still more effective, because other measurements actually are becoming less and less sort of enforceable. Although actually we know, like in U.S., in other countries, indoor wearing masks and other policies actually came back, but certainly we'll see more pushback to that. But vaccine, again, I want to emphasize actually vaccine actually really works even in the context of Delta.
I see.
Certainly we see more surges, but actually it still prevent severe and also death to significant degree.
Finally, before we go, since our topic today is about that specific conference on vaccines, how much do you see international cooperation should really work in this regard? I know it makes sense, but still, it's so hard to get one sentence from every one of you before we go. Let's go with you, Dr. Tulenko.
Well, I think we certainly see China using global health diplomacy, or what's often called soft power, in organizing this. And I hope, 1 year from now, we will see a world that has a more distributed, fairer system of actually producing vaccines.
Dr. Tan.
I don't never have too much cooperation, but there are multiple platforms right now for international cooperation. There's a task force in which the WTO, the World Trade Organization, WHO, World Bank Group, and IMF, they're all on board and trying to come up with a plan forward and have everyone on board. I think we should have a cohesiveness between the international groups and the platforms, because this is a global issue and we need cooperation on a large scale.
1 + 1 hopefully is bigger than 2, right? As you said. Dr. Ding, before we go.
Yes.
Yeah, certainly China playing such leadership role is actually very useful. In such situation, we really want to have someone to lead. Certainly more is better, certainly with already 700 million doses committed, distributed, as well as more actually coming to play. I think having this leading role actually would play an important part.
All right. Ding Sheng, Alice Kim Kyung Tan, Kate Tulenko, thank you so much for every one of you. Really appreciate it, and be safe. You're watching World Insight with me, Tian Wei. Coming up, national security in the shadow of a variant-fueled pandemic and threats to digital security. How can China steer through choppy waters? Advice from an international relations expert. Up next. Welcome back. This is World Insight. I'm Tian Wei. China believes development and national security are two key issues for its future. So last month, China lost no time rolling out the data security law, which will take effect September the 1st this year. Also in the pipeline is China's first biosecurity law for prevention and control of infectious diseases. The country is still facing challenges in the familiar geopolitical frontier. For example, many believe the U.S. rallying allies against China and efforts to delist Chinese companies from the U.S. markets. There are also small spikes of COVID cases around the country. How could the country better safeguard national security with all these headwinds? For answers, I talked to Professor Yuan Peng, the president of the China Institute of Contemporary International Relations. Let's listen in. Professor Yuan, what a pleasure to see you.
Me too.
Many have been talking about the rise of awareness in China about national security, but exactly through what lens should we understand this rising awareness of it? And what is Chinese policymakers thinking?
Actually, national security is the priorities for almost every country in the world, and also including China. From the PRC establishment, from Chairman Mao to Deng Xiaoping to all the generations of the leadership, we all pay attention on the national security. But now I think China is entering a new era. New era means many things, but at least one thing is that our national security environment, the challenges of which are unprecedented. For example, we are facing both traditional security issues like military security, sovereignty, territorial disputes, sorts of traditional, and also facing so many non-traditional security challenges. So how to face all those challenges in this very specific era, which means we're now entering into from the first centenary plans to the second.
Right.
We're facing more difficult tasks. So in these very terms, we need more cautiousness on national security.
Right. There are a lot of concerns coming from international investors about exactly what is China's direction of making policies and what does national security really mean to them and many others. Your take?
Yes, because we're facing so many difficulties, challenges, so President Xi proposed a very new thinking that is a holistic approach of national security. Means we need balance, so many different sorts of national securities. But the most important is how to balance the development and security. In past 40 years, accompanying with the reforming and opening up policy, maybe we put more attention on development. But today, we need to balance, make development more secure. So balanced development and security is a first priority for us to pursue.
If you look at what China has been doing, you see also escalation of scrutiny coming from the U.S. side, for example. The SEC recently suspended some of the Chinese companies listed in the United States unless they are providing sufficient information more than they were asked before. So how do you see this escalation of demands coming from different authorities against or for these companies?
When we're talking about Chinese balanced development and security, mainly our target is our own companies. It's how to manage our own companies to make them development in the healthy track. a comparison with an American's national security law, including SEC and CFIUS, they have more leverages and more, methods to target as foreign companies. I think the nature of which is different. Sometimes what concerning Chinese companies more is that American government using, sometimes even abuse of its national security as a leverage to attack Chinese high-tech companies. I think this is a different, because American is a long-time superpower in the world. They are good at using those national security as an methods, as an excuse to attack its foreign competitors. So in this regard, China is a defensive side.
What are the practices you think U.S. is using?
For example, long-arm jurisdictions, for example, economic sanctions, sometimes even using military methods. So in this regard, the Chinese side still is a very defensive side.
Will China change to the American
I think
type?
we're a different country. America's national security is for protect its a leadership role, leadership position, is to protect the hegemony. Chinese national security is to defend the Chinese, sovereignty, territorial, and the normal economic development, and is for the average Chinese people so living a better life. So the nature of which is totally different.
We see the national data security law is likely to be exercised beginning from September the 1st. So, Professor Yuan, are we going to see one after another new legislations in China concerning national security? How could, investors, foreign friends, and those that want to interact with China know more about what's going on, and so that they can plan?
Yeah, data security law is not Chinese invention. Every country, in particular those big powers, has its own data security law. China is a latecomer, actually. And every country, the leaders facing the same difficulties. That is how to balance to protect the individual privacy and its national security. Some countries maybe put more attention on privacy over a person. Some others maybe put national security as a priority. For China also is challenges. So we are doing our best to balance. This is one thing. The second thing is, and the data security law, we can view this as part of one systematic jobs for China. That is rule of law in a all-round way. This is we have a four comprehensive list. This is Chinese grand strategy. One comprehensive list is that rule of law in a all-round way, comprehensive list. So this is a part of our rule of law. We have brand new hundreds of new laws in past several years. Data security law just one of many.
Now, another thing is about the biosecurity. With the COVID-19, earlier SARS, a lot of people are paying attention certainly to that, China as well. But how do you see, the latest incidents of politicization of COVID-19, that debate going on in the world, vis-a-vis China's approach in terms of, pursuing security in that regard?
Biosecurity for many countries like America is not a non-traditional security issue. It's already a traditional security challenge problem. But for China, still something new. It's a non-traditional security issue. From SARS to the recent COVID-19, force us to think biosecurity. For many Chinese researchers, officials, let alone the average people, it's a new thing. It's a new thing. But we have to pay more attention on this. This is on the one hand is how to deal with those natural virus like COVID-19, SARS. And also, on the other hand, how to deal with a political virus, like politicized those COVID-19 into a tool to attack its competitor. So all those force us to think bio in a security angle. That's why we're now paying more attention on biosecurity.
But how to understand Chinese way of emphasizing on national security, how is it going to compare to, let's say, others? You were talking about China's and the United States, but how should others really understand China's approach?
Chinese approach is number one, people's security first. This is very clear from recent COVID-19, Wuhan, from many other cities. We always put people's life first. So compared with some other countries, their election, their votes first. People's life maybe not the first. This is very clear. And secondly, political security, we put it at a very high level, high priority, because in China, Chinese Communist Party and the Chinese government, we are sometimes united into one. So that's why when some politician want to separate the party from the people, they don't understand that party and people were one. So how to make a political security more strong is very important for Chinese moving into a stronger nation in the future. And thirdly, I think we also put economic security in a very important area, because Chinese secret of Chinese success lies in success of our economy. Economy is the foundation for Chinese development.
Right.
And also we put military, social, and other area security also important.
On the one hand, guarantee and safeguard one country's national security is understandable. Everybody is doing it. But on the other hand, how to make sure you can still make friends around the world, that seems to be a very interesting fine balance. How do you, as a national security expert, look at that fine balance?
First of all, I think when China defends our national security, I think it's a very basic, basic demands for China to pursue its modernization. Need to be understood by the world, by the other countries. This is a precondition. You cannot using politicized eyes to view everything that we are doing. This is a condition. And secondly, we need to do more explanations to outside world. And thirdly, I think we need more communications. I think even from recent Chinese American officials communications, both in Alaska and Tianjin, some others see they are quarreling with each other, but at least they are in a communication way. Communication is very important. Even if we have different stance, different principles, but when we communicate, I think at least the other side will know what's your concern.
How is China looking at the United States in terms of its global map seeking security?
Americans' way to defend its national security, I think, cannot be a model for China and for other countries, because America is unique. First of all, it's only a superpower. They have enough money, enough person to for example, they have more than 700 billion US dollars is annual defense budget, maybe equals to all other countries combined. So they can defend its national security in every corner of the world. And sometimes to defending its own national security, they can use every means they want, including the military war. So China cannot follow American model. Our national security is much more limited. Want to defend our people, our territory. We will not pursue a hegemon. Okay. And secondly, our national security is for Chinese people living a better life in a better world. So we won't follow American way, and we won't admire American way. And I also hope that in today's world, we can only pursue the relative security rather than absolute security.
Professor Yuan Peng, as always, what a pleasure. Thank you so much, sir. I talked with Professor Yuan Peng, who is the president of China Institute of Contemporary International Relations, who's well known for his research on national securities of China. That's all we have for today. If you'd like to see more Search World Insight, check out our YouTube channel, follow us on Twitter and Facebook. I'm Tian Wei. On behalf of the team, thanks for watching. Bye for now.